Hi, good evening, everyone. Welcome to Oakdale's Facebook Live session. This is a special session that we have to talk about the impact mentally, physically of COVID vaccines, COVID vaccine hesitant, as it impacts our communities, particularly the African American communities. Where do we go from here? So today we have two special guests who will introduce themselves. We have Dr. Dorian Miller and we have Dr. Donnell Barnett. And we also have Reverend Dr. Pastor Griffin, who's on as well, and Diane Smith, who will be answering questions or taking questions from the chat that we will answer and talk about later. So Dr. Dorian, would you like to introduce yourself?
Thank you so much. It's a pleasure to be here with you today with the Oakdale Covenant community, and thank you, Pastor Griffin and Ms. Julian, for the opportunity to be with you. My name is Dr. Dorian Miller. I'm a professor of medicine at the University of Chicago and also the director of the Center for Community Health and Vitality at the University of Chicago. And basically since mid-March of 2020, I've had the opportunity to share with many community audiences the emerging information around ways in which we can both protect ourselves against COVID-19 infections and also sharing information around the vaccine. This has been an incredibly difficult time, I think, for so many communities, but particularly for our communities as African Americans, because it's not just been the question of COVID-19 and its impact, but it's also been the question of experiencing many of the things around the issues of George Floyd, Breonna Taylor, Ahmaud Arbery, and other things that have affected us, not just in terms of our physical health, but our mental and emotional health as well. So I'm happy to be a member and to be a part of this conversation this evening.
Dr. Barnett.
Well, good evening. Good evening. I am so glad to be here. Thank you so much for having me. I am Donnell Barnett. I'm a clinical psychologist by training. I serve as the Deputy Director for Mental Health Clinical Operations with the Illinois Department of Human Services. And I'm also a member of Oakdale. And it's, again, very glad to be here. This has been, as Dr. Miller mentioned, such an impactful time for communities, for individuals, for families. This era has touched us in so many different ways and so many different aspects of life. And having gone through it for close to 2 years now, you can see the wear and tear just in so many different areas of our lives. And so a lot of my work has centered around working with groups and teams and organizations on how they are adjusting in this new environment. So very happy to be a part of this conversation, and thank you so much for having me.
Dr. Barnett, you mentioned that we've been in this situation for about 21 months. That's a long time. And Dr. Miller, you mentioned about the impact other than just COVID so this pandemic has raised a lot of deficiencies that are happening in our community, from things like not being able to connect to technology, job loss, or those who cannot afford to take off, because they were considered essential workers. Their kids are at home who they may have access to technology, but at grandma's house, they may not. So can you talk a little bit, or either one of you, can you talk a little bit more about what's happening currently?
Well, I'll start with the issue of children first. Fortunately, our children have been able to get back to school, although there have been some issues in the schools around new cases that are of COVID-19 that are identified and children having to quarantine. And so it's not been a completely normal course in terms of getting children back into their regular routines. But one of the things that I think has been at least somewhat helpful around getting children back into schools is that there are opportunities for teachers and counselors to get a better sense of what's going on within the home and also with the mental health of our children in this space. Another issue that I think is important is that for the people who have had family members that have passed away during this time, whether it be from COVID or for other reasons, that there has not been the normal opportunity to grieve and gather the way that we normally would as a community. I went to a funeral for one of my patients who passed away summer of 2020. So this was in July of 2020. And it was at AR Leak on Cottage Grove. And people were lined up outside and going in to view the body only in groups of 10 at a time. And this was a very large family who was gathered in order to mourn the passing of their loved one. And it just to see the disruption of the normal ways in which we comfort one another at a time of distress, I think was just quite striking in my experience.
Yeah, I was thinking about your setup to your question when you highlighted essential workers and the economics and all these other sort of social issues that I think people really weren't prepared for when, sort of the evolution of COVID-19, it got, laid on top of all of these other social inequities that were already there, but it just highlighted it. And so folks have been dealing with struggles on their jobs, dealing with sort of the technology divide, not having internet access and other kinds of resources from day-to-day living. Those were challenges that people, particularly poor communities, were dealing with before COVID. Then COVID-19 came along and added on top of that. And so that's another part of this story that is really contributing to the stresses and trauma and anxieties that we're seeing from a mental health perspective.
So the issue that you raised a moment ago, Virginia, I also think is very important about essential workers. And that for so many communities of color, particularly African Americans and also the Latino community, there are so many of us that are in jobs that are considered to be essential workers. And one of the things that I found as a primary care doctor, it's getting a little bit better now, but it was over a year before it was actually getting better, was that people who are working as certified nursing assistants and going into people's homes and helping them with their activities of daily living. If you need to have someone to help you with bathing or grooming yourself or other activities within the home, because there was such a fear of being able to pass things on, not only did I have a lot of difficulty having people and referring people to home health care agencies to get services, some of my patients who really needed those services in order to be able to stay in their homes safely were refusing those services because they were afraid of perhaps getting COVID-19 from someone. And so it's been tied up into, I think, many things in terms of not only being essential workers and being at risk for contracting COVID-19, but also the people who are in most need of services oftentimes were not able to access them. And so they had to depend more upon their family members and friends to provide services, and that impacted their ability to be in the workplace. So kind of a domino effect that we've seen here.
And, I want to add to that, the statements that have been made, is the fact that as a pastor, I'm the pastor of Oakdale, but as a pastor, I have never been this busy in my life with pastoral counseling and issues. And of course, we couldn't do a lot of in-person to visit and things like that, but my phone was certainly blowing up. I mean, people were very stressed about it. They were stressed as families because they've been used to going out for 8 hours and going to work. And so now to be in the house all day and trying to figure out how to manage that, and the relationship is already strained. And then you add the whole teaching the children online. So it was a cocktail for a lot of drama that we had to experience. I think we did at Oakdale over, I think Savona, it was like 110 funerals. I mean, we were burying people left and right. And it was taking its toll on me as a pastor, as well as the staff. We were just exhausted on it. And then on Sundays, we come in, we do the worship, even though we do it live stream, but we came in every Sunday during the pandemic. It was probably about 10 to 12 or 15 of us, socially distancing, but literally we were risking our lives each Sunday. We didn't know how, if we were going to catch it or not, but it was a very difficult time. So as a pastor, I felt the weight of it like I've not felt in my 25 years of doing ministry. I've never felt anything like this.
So then what can you say to individuals who are those frontline workers that are directly involved with individuals who are experiencing losses, not just loss of life, but loss of job opportunities, loss of freedom to move about, all those kind of things like that. So what would be some suggestions for individuals who are impacted like that?
Well, as a pastor, I know I'm going to jump. Let me just say this, and as a pastor, this is why we have Dr. Miller and Dr. Barnett on here, because we need to encourage people to not just go to your pastor for counseling and all that, but to get a therapist. I really believe that people need to make sure that they're in therapy or in counseling to begin to help them navigate some of this. And I know there's a huge stigma within our community about going to therapists, about, you must be crazy because you go. No, I have a therapist. All of us, you need a therapist to help you navigate some of this because it's too much for us to handle on our own.
I would absolutely agree with that, Pastor Griffin. And it's one of the ways in which, as a people, we build our resilience and armor in order to really navigate these extremely difficult times. I have referred many of my patients who have been struggling through issues around COVID-19, whether it be the family issues that you mentioned a little while ago, whether it be personal issues. Had patients who have recovered from COVID, but are having problems with depression and anxiety that are related to it, to say, I understand what's going on, and I think that you need to see someone. I can certainly prescribe a medication that might help some of your underlying symptoms, but you really do need to have a few more tools in your toolbox in order to be able to cope with this, so that you can become more resilient as you come out of this, and also to provide them with a sense of hope that we will come through this. It's just taking a really long time.
Yeah, I was just thinking, one of the really interesting things that we're starting to see now is we've been in this for so long. And as was mentioned, the mind and the body wasn't designed for prolonged stress, right? It's fight or flight, freeze, get out of the situation, deal with it and move on. But when you're in the situation for so long, it starts to have a lot of wear and tear. The interesting piece that we're seeing now is people are also starting to reassess their lives. They're reassessing their careers. They're reassessing goals and things like that. And I think it might have something to do with being in this for so long. You hear people talk about the great resignation of folks, sort of leaving their jobs and, sometimes not going to another job, or they have a new career, they want to switch. So, just sort of acknowledging both things are happening at the same time. There's some a flicker of good things happening for folks, and then there's a lot of stressful things happening, which can be very confusing. And so that's another reason to get counseling, to help think through all of these competing things that's going on in your life and in your world.
I was in a meeting earlier today and we were talking about mental health therapy. So one of the counselors that was on the line, she said, in our communities, we have a problem, just as previously mentioned, about if you say that you need to seek therapy, the first thing is, I'm not crazy. Then she said, why not we call it wellness? Go and get your wellness checkup. Look at it from a different point of view. It's not necessarily that you're crazy or anything. Sometimes you just need to talk or need to have someone to walk you through some different strategies to look at it from a different perspective versus saying, oh, you need to go see a psychiatrist. Now my whole family is going to think I'm crazy. No, they're going to know you're crazy. You're the last person to probably know you're crazy. So it's important to really get some kind of help. So she suggested wellness therapy. And I thought that was a nice spin on words in terms of you're still getting the same thing, going the same route. It's just called a different thing. And I like the part where you mentioned about a lot of different changes. Some people have mentioned things like this is an opportunity to spend time with their family members and get to know them in a different kind of way. So last year we did, or earlier this year, we did a memorial for some of the members who lost members, and a lot of them spent time writing books, writing stories, doing rehab, getting to know their family. But then we have other situations where the home is not necessarily a safe place during the pandemic. So what kind of advice would you offer those family members or people who are in those situations?
Say that one more time, please.
So you have family members, they're building resilience during this time, but for others, it's trauma. So they're at risk of being abused, neglected. So it's not a safe haven for them to be at home at this time. So what kind of things or what kind of words or resources would be available for those type of individuals who may be in those not such safe situations?
Well, I'll start. Um, Really, you really want to reach out to whatever lifeline you can find. Um, there was a period of time when the schools were closed that we saw a dramatic drop in the number of DCFS, child abuse kinds of reports, because the school is most often the place where that kind of issue gets identified. Well, kids weren't in school, and so the reports dropped. And it says something about society in the sense that people, students at least, kids at least, do see teachers and principals and folks like that as a lifeline for them. And I think that that goes through the rest of our life, that when you're talking with your physician or your pastor or even a friend or a teacher, someone in your life will be there to assist and guide you and help you get to whatever resource that you need. The important thing to remember is to reach out to someone, find someone. Someone in your world is going to help you and help you get to the next step of that journey.
So I'd like to circle back to vaccine hesitancy, some of the myths. What kind of myths are you still hearing related to COVID virus, COVID vaccines? Well, I know we were hearing a lot of different myths in the beginning of stages where it had a chip in it, They would change your DNA and things like that. So are you still hearing those same stories, Dr. Dorian?
Thank you. Sadly, yes. I am still hearing those stories. And then I'm also hearing something very interesting, particularly from my younger patients. And when I say younger, I'm a doctor who cares for adults. Most of my patients are over the age of 45, but I do have a group of patients between their mid-20s through their mid-40s. And the response is, thank you very much. I'm doing my own research. And when I press a little bit more to ask, well, how are you learning about research? And it's been, and about the things that are happening around this. I said, are you looking at websites from the Centers for Disease Control or the Food and Drug Administration, or maybe one of the medical centers that are in the area that are putting out information about COVID-19, or our departments of public health? And they go, oh, no, I go to social media, and that's where I learn and where I do my research on what's taking place. And I see stories about different issues that are coming up around becoming sterile, having problems with reproduction, all of these things. And so therefore, I'm not going to have the vaccine. I will say that once the vaccines were made available almost a year ago, it was mid-December of 2020 when we first started having vaccines available for first health workers and people in chronic care facilities before we opened up to the general public. During that 3 to 4 month period, early this year, I had a lot more success in talking to my patients around the reasons why I thought that it was important for them to get the vaccine. Probably late spring, early summer, those types of conversations were dropping off, and people were really putting up their barriers and saying, no, I don't want to do this. I have my reasons. I always ask my patients, okay, I hear what you're saying. Is it okay with you if I raise this with you at another time? And to at least are you open to continuing the conversation? Because it may be a no for now, but not necessarily a no forever in terms of acceptance. And I also will ask the question, do you have questions about this that I can share with you? So as opposed to having a set script and saying, 3 or 4 facts around the vaccine, I will try to tailor the information that I share with my patients based on their fears and concerns. So in some cases that has opened the door around it. And even some of my patients saying, and I think that being an African-American physician and being someone who's born and raised on the South Side, I've had a few that have looked at me and said, well, did you do it? And I said, well, yes, I did. And it's one of those rare times that I say, and I had to tell them which vaccine that I had, and the first and the second. At this point, I've had a booster as well. And I share with them what I felt, in terms of physical symptoms after the first one, after the second one. As you know, that's usually not the kind of thing that health providers are supposed to do, is sharing personal information with their patients. But I'm really in the business of doing things that hopefully will help to save them from getting COVID and possibly dying from it. And so that's the reason why I've taken that extra step to share my personal experience.
Absolutely. That's great. When you told them that you had taken the vaccine, what were some of the reactions to that?
Some of my patients sat back in their chairs and said, what? They were really surprised. Others just sat there and went, as if I had drunk the Kool-Aid, so to speak, and was an agent of whatever body was trying to push this on it. But that was more the exception rather than the reaction. Most people I've never had anybody to be rude about it. They've always been polite, whether it's been a yes or a no or maybe. But what I've tried to do is that I've tried to keep the door open for conversations down the line, because I want to make sure that I'm not only focused on helping to keep my patients as healthy as possible and to keep them from getting COVID, but also I've got all of their other medical issues that I have to deal with, high blood pressure and diabetes and arthritis and other things. And so if I start down one path and essentially close off the door for open communication, they may not trust me around the other things that I need to work with them around. So again, factual, non-judgmental, and an open door in terms of being able to discuss some of these issues, if not at that visit, at a later visit.
Dr. Miller, you're so right. I don't always hear these issues in the life of the church, but when I go to the gym, I'm around a whole group of people. We're working out, and the questions arise sometimes is, did you get the vaccine? And of course, I'll always say, yes, I did. And that sparks a lot of questions and things like that. But one thing that you just said was, I'm not judgmental about their decision, because what ended up happening is as weeks went by, because I wasn't judgmental about it, I just said, look, why don't you kind of learn a little bit more about it, and don't just go to social media. Go to places where, where people who are experts at this can give you the information. And then you started to see people slowly coming up to me saying, I got the vaccine now. I got the first shot. I got the second shot. And I think that I come at them with this condemnation or judgmental behavior, it might have run them away, knowing that they might have gotten it. But I'm just saying, I think sometimes we just need to diffuse the situation, because the media in certain media outlets and certain communities and certain social media following is really, really helping people put these walls and barriers up that's really killing us, and of course, I can say these things on Sunday morning at church, which I say to people, look, we bury a lot of people who did their own research. Mm-hmm. We had their funeral at our church. They did their own research, but they died because they're not an infectious disease specialist. They're not a primary physician. They're not so they died as a result of listening to other people. And then I tell people, it's funny because when people, as you know, Dr. Miller and Dr. Barnett, when they get sick, they don't mind an experimental drug. Just don't give me the COVID one. All the other experimental drugs that have not been tested on a wide variety of people are okay to be used. Just don't give me the COVID one. Mm-hmm. That's the thing that blows my mind. Is I'm sitting there talking, and I just had this a couple of weeks ago with one of our members at the hospital. Oh, I know I'm sick, but I just don't want that COVID drug. But you had all these other experimental drugs. Okay, you don't know what's in them, and yet you didn't have a problem with that, and yet you have a problem with the COVID-19. The vaccine. It just doesn't make any sense. And I don't think I've ever seen I don't think anybody has ever seen anything this backwards in my entire life.
Pastor Griffin, the points that you're making around things that are experimental versus not, as I think about discussing this with my patients and also figuring out how to provide targeted messages that hopefully will help people in a non-judgmental way. The virus has come up on us with such great speed, and that oftentimes I think that we have a lot of difficulty dealing with uncertainty, in that the question of how do we right the ship, so to speak, and what takes place. People know if, for instance, if someone is diagnosed with a cancer and that there's a potential opportunity to say, we can cure you of this, we have this drug in development, that they can wrap their heads around having a particular type of cancer. But because of, I think, all of the lead up to this in terms of the way that our society has become so tribalized and people are fighting with one another, that this has helped to feed into who is actually my ally, who is there that's going to help me and to provide me with the information that I need in order to make a decision. And because there seems to be a lot of difficulty in dealing with, well, yesterday you said I didn't need to wear a mask. This was when we dropped the mask mandates in June. And then when we started to see the Delta variant come about and rising, and suddenly they said, no, we've got to go back to social distancing, putting masks on, et cetera. People have said, well, what is it? What's the answer here? And it's because although science is the way that we're going to get ourselves into this and out of it, still continue to learn a lot about the science every single day. And that's a piece of it that I think many people have a lot of difficulty managing. And so therefore they say, well, you scientists can't figure it out, therefore I'm going to sit back and do nothing.
Dr. Miller, can you talk about, we're talking about experimental kind of things. Can you talk a little bit about the treatment that happens to someone who is hospitalized with COVID? Is that still in the experimental phases too, or is it not in the experimental phases in terms of the treatment plans that have been developed?
We have a number of treatment plans that have been developed in order to help people who are hospitalized with COVID-19 infections, medications that are helping to stop COVID-19 in its tracks, and also supportive medications that are not experimental in order to treat some of the side effects of the infection. And so to give you an example, one of the things that we found with COVID-19 is that it sometimes will cause the blood to clot, and to clot in ways that is causing blood clots in the lungs. And for some people who are recovering from COVID, even people have had hair loss because they've had decreased blood flow to their scalp. And then subsequently, they have lost hair as a result of being infected with COVID-19. And so when people are hospitalized, oftentimes they're put on medications that will thin the blood called anticoagulants in order to try to prevent some of the complications that we're seeing from the actual COVID-19 infection. Early on, and this is for somebody who was first diagnosed but is not necessarily in the hospital, we found that something called monoclonal antibodies can actually decrease the severity of illness. And then there are a number of medications that are coming out in pill form but have not yet been approved by the Food and Drug Administration. Pfizer has one under development, so does Merck Pharmaceuticals, that can actually treat it with a pill. Now I'm saying treat, it doesn't necessarily mean cure, but it does mean a decrease in terms of the severity of symptoms. And so very clear to think about this, to say it can be helpful in helping you get over COVID. But the one thing that for people who are watching us today and are listening to this is to remember that this is a contagious disease. It's not just an infection, but it is a disease that one person can spread from one to the other. And so you may be thinking, well, I'm not going to worry about getting the vaccine because we've got all of these things that are just on the horizon where I'll be able to get those monoclonal antibodies and I'll be able to get treatment for this and I'll be okay. The phrase that I want to emphasize here is the I part, and I and contagious conditions do not go together, in that if you are infected, you can spread the infection to someone else who may not fare as well as you do. And it could be someone that you care about very deeply, somebody who has a lot of health problems like high blood pressure, diabetes, cancer survivors. others who will not fare as well if they become infected with COVID-19. And so I think that as we think about how we address this as a community, that we think about not only the care for ourselves, but extending that care to someone else. And so for not only for ourselves, but for the people who are within our circles to really strongly consider how this might impact others.
Thank you. Can you also talk about, you hear the term long haulers. What does that mean?
So there are some people that we're finding that have prolonged symptoms from COVID-19. We're finding that usually the recovery period once someone has an infection is over about a 2 to 3 week period of time typically. But there are some people who are experiencing long haul COVID symptoms that include sometimes mental fogginess, that is their ability to think clearly is sometimes impacted. I mentioned the issue of hair loss just a little while ago for some people who've had COVID-19. For some people that have had COVID-19 that's affected their heart, they will have periods of time in which their heart will race and have extremely rapid heart rates that will come and go. And so that's something else that we've seen for people who are considered to be long haulers, as well as just changes in mood along with it. So going beyond the brain fog, and maybe Dr. Barnett can talk a little bit more about some of the mood issues that we're seeing along with long haulers.
And I'll have to admit, I'm not terribly familiar with the specific challenges, but in general, when you don't have an ability to think clearly, then of course that leads to frustration because you're not accomplishing routine and daily tasks at the level that you expect yourself to be able to. That frustration can lead to, kind of anger. It can lead to strained relationships because, you're not having the same kinds of interactions that you might expect. If you work in positions where you need that a high degree of mental clarity, that could then lead to sort of occupational challenges and being able to continue there. So it just there kind of triggers a waterfall of things that could happen just from that one simple symptom of not being able to think clearly. You then start to think about, how, self-esteem, you think about your mood, depressed feelings, how that contributes to the inability to have a quality sleep, which then complicates other kinds of challenges. And so it can go on quite a bit in terms of all of the related complications down the road.
One of my patients who developed COVID-19 back last year in the late spring, who had been highly functional, someone who is in their early 70s, is now, because my patient is unable to navigate their own taking care of paying the bills and business, et cetera, that she's now living with family members who are looking after her. And this was a very dramatic change in terms of how she was able to care for herself as a result of having had a COVID infection. And in fact, this patient's presentation was not the typical fever, runny nose, inability to smell, cough, etc., but it was what we call altered mental status, in that the person came in to see me, and having known them for a number of years and sitting down, they just weren't themselves and were very confused and trying to figure out what was going on. And in fact, ended up being positive for COVID-19 and had more of what's called the neurological manifestations of COVID-19. Something else that we're also seeing is that we're actually seeing more people to present with new onset diabetes as a result of COVID-19. And we think that the virus is affecting the body's ability to produce insulin from the pancreas. And so that is something else that we're seeing.
Do you have any studies or any information about how COVID is impacting kids too? I know we have a lot of information for adults. What about children?
So I'm a doctor for adults, but I will share with you what I've learned from my colleagues who care for children. Children tend to tolerate COVID-19 infections a bit better than adults because actually the coronavirus is actually a family of viruses, and some of the coronaviruses are responsible for the common cold. And so, as you know, anybody who's had any experience with children, children tend to be little germ factories in terms of passing viruses amongst one another when they're in school settings and play settings, et cetera. So they tend to do better, but there are some children that have had this condition called the multi-inflammatory syndrome for children, or MIS-C. And that's a condition that has landed many children in the hospital with complications that have included issues with kidney failure, issues with clotting of their blood, issues with inflammation of the heart. So there had been a number of children that didn't have an underlying health condition that would predispose them to this, meaning the children didn't have things like cancer or sickle cell or asthma or other things that have developed this multi-inflammatory syndrome of children that's been quite difficult to treat.
Thank you for that. So now that we have the vaccine available for children, there is an article that came out where Big Bird, who is probably really old, but he's turning 6, in this particular advertisement where he's received the COVID vaccine, and it's been a lot of backlash. What are your thoughts around that?
So I think that parents are naturally cautious about introducing things to their children. And even some parents have said, I will get vaccinated, but given that I want their idea around it as being protective of their children over the long run, that they may not necessarily recommend the vaccine for their children. They also may say, well, more than likely my child is going to have a mild course of this if they contract it, therefore I'm not concerned about it. The issue of contagion, being able to pass the virus on to someone else who is very susceptible to having a complicated course with this, either hospitalization or even dying from the complications of COVID-19, I think is an issue. If I could be allowed to share my screen for just a moment so that you can see this, I can share with you some of the information from our meeting today around children and how many children have been vaccinated for COVID-19 within the city of Chicago. And so this is data from the Chicago Department of Public Health that you'll be able to see on the screen, that's broken down by age, but it's also broken down by race and ethnicity. And since for several months, children over the age of 12 have been able to receive the vaccine. And I'd like for you to take a look at the circles that you see here for the 12 to 14, the 15 to 17-year-old range for Black children in comparison to white children and Asian children in the city. And you can see from this that we are vaccinating children at a far, far lower rate for those who have been eligible for the vaccine for, as I said, a few months now through the emergency use authorization. The data obviously is going to be very low for children between 5 and 11 because it's just been authorized. But even there, you can see in comparison to white children and Asian children, the rates are very, very low. So again, the question of thinking about the protection of our children and what's going on within our community is something that I think is quite remarkable. This is data that I'm sharing from a meeting that's been going on since almost the very beginning of the pandemic, called the Chicagoland Vaccine Partnership, in which health delivery systems, public health, community-based organizations, faith-based organizations gather in a room like this on a weekly basis on Tuesdays at noontime to talk about what's happening in the community with fresh data that comes out of the state and the city and Cook County in order to figure out ways in which we can help to support the community around both COVID-19 prevention and mitigation.
Thank you for that. It seems as though there was a rumor where someone said parents who are fully vaccinated tend to vaccinate their children. But then there's another group of parents who say that we're fully vaccinated, so we're not going to vaccinate our child because of herd immunity. What is herd immunity?
So herd immunity is when there are a certain percentage of the population that have developed immunity from a disease, whether it be through natural infection or through vaccination, at such a level that the transmission of that infection is very low in the general population. And so you may have heard floated, and we were having more of these discussions back in the summer, that if we're able to achieve, say, 75% of people having immunity, either through vaccination or natural infection, that we should be able to tamp down the positivity rate of COVID-19. And as I said, numbers have been floated between 75% up to 90%. The issue with COVID-19 is that it's a virus that wants to survive. It's a parasite. It has to have a host to live in order to survive. And in order to do that, it's a trickster in that it will develop mutations to try to get around any of the natural immunity or any of the immunizations that have taken place for COVID-19 because it wants to live. The more people who are unvaccinated in society, the more opportunities that the virus could not only infect them, but also mutate into a strain or change into a strain that will have more difficulty having a vaccine that's active against it. And so that's the reason why getting more people vaccinated actually helps us to decrease the transmission of the virus overall in our community. And so I'm going a little bit further than just answering the question about herd immunity, but it's the reason why being able to raise those vaccination rates and to generate some herd immunity will help us the most in the long run.
You mentioned mutations, so that's why we hear so much about the Delta variant. So would that be an example of a mutation?
That's correct. The Delta variant is an example of a mutation. And not all mutations are necessarily mutations that are more likely to provide infection, to spread from one person to another or to evade the vaccinations that have developed. Sometimes changes take place at random, and sometimes viruses can burn themselves out after they've gone through a certain number of mutations. But we just, in the case of COVID-19, we don't know if that will happen. And frankly, because of the terrible COVID-19 epidemic that occurred in India during the winter and the spring, and all of the deaths that occurred that was a result of the Delta variant and its subsequent spread to Europe and then now to the United States, we already know that that particular variant is one that is not only more likely to spread from person to person, but also more likely to be deadly. And that's one of the reasons why we're really concerned about this winter, because we're going to be indoors. It's a respiratory virus. It's spread by droplet contact from person to person. And so the question of seeing the increase in rates within state of Illinois, city of Chicago, has been somewhat concerning for our public health officials.
Dr. Burnett, for children, what happens when you have a child who wants to get back to normalcy and they're asking their parent, why can't I get the vaccine? so that I can start to participate in sports, so that I can maybe hang out with my friends in a safe way? How would you negotiate that?
Children, when they are stressed or frustrated, it comes out in a lot of different ways. Obviously, they're not as verbal and don't quite articulate their stresses, and so you'll see it come out sometimes in acting out behaviors. You may see it come out in other kinds of sometimes harmful behaviors. And so the conversation, a parent would be one of the first initial people to notice a difference in the child, to notice a difference in the child's behavior, and then clue in an opportunity to sit down and talk and have conversation. And that conversation doesn't necessarily have to be like, sitting at the dinner table kind of thing. It could be with a coloring book. It could be over some chicken nuggets. It could be over a number of different things, just to open up some insight into how the kid may be interpreting all that's going on around them. And that would then give some information for the parent to then begin to think about what would be the next step. Um, uh, Kids who have not had an opportunity to interact with other kids and go out and play and have fun and do all the things that you should do as a kid, the family has to be really creative around creating childhood experiences in the constraints that we're all living in. So those are some of the things that a parent might do to kind of have some conversation and mitigate some of the challenges that kids are experiencing, particularly younger kids.
Diane, did you have any comments or things to add?
I just have one question from Facebook that I would like to ask Dr. Miller now. Great information, some folks have said. One question that I would like to ask right now is, can you experience the symptoms without testing positive? I have noticed the symptoms myself, and I am vaccinated. So if you could touch on that a little bit.
Certainly. So I have had a few patients who have tested negative a couple of times and then later tested positive. The ideal time for people having a positive test for COVID-19 is actually anywhere between 3 and 9 days into the infection. And so if it's rather early in terms of the development of symptoms, they may not necessarily test positive right away. The other thing is that how the test is taking place. And so there are home antigen testing kits that are available at the drugstore, a very popular one, and I'm not advertising or any one over another, but the Abbott Binax antigen test is out there. The ones that we use at the hospital are actually something called PCR testing, which is a slightly different type of test. It's a lot more sensitive in terms of being able to detect the presence of the virus. But even with some of my patients, if they've tested a little bit too early because their viral load has not increased to the point where we can detect it with some of the PCR testing, that they will have symptoms, but they test negative. I always tell my patients, you should presume that you have COVID until it's determined otherwise, because of the contagion, the ability to spread from one person to another, that they should isolate themselves and then if need be, get other testing, particularly at a site where they know that we're doing what's called PCR testing in order to confirm. So that's what I've been usually telling.
I think you're frozen.
Yeah, I think she's frozen. Yeah. Well, she's kind of becoming unfrozen. Dr. Donnell, do you have any final comments that you would like to share?
One thing I think I was thinking about is how the world has seen many pandemics before, and COVID-19 isn't the worst. It's not considered the worst of all pandemics. But a lot of the principles that we talk about today in terms of vaccines, social distancing, masks, quarantines, these are principles that have been learned from pandemics before and other illnesses before. And so this notion of around doing research, doing your own research on social media and that sort of thing, I think it's important to balance that with what we knew before we got to this place, and what we knew helped our parents and generations before us. It helped our ancestors through really difficult health situations before. And so that is one thing that I think, we can kind of hold on to in this era of myths and misinformation and that sort of thing, is realizing that many of us are here today because our ancestors practiced sound protocols, or took the advice from places that were really useful to help them survive and get us here to here today.
That's a great point, Dr. Burnett, because the Black church has been sort of the focal point for the community for many generations. It was a therapeutic community. It was a place for affirmation. Lots of things went on in the life of the church. And the announcement time in the church was important because that's where people got accurate information. They got information related to resources, and all of those things were there. And I think in this climate of this COVID-19 pandemic, we need to go to reliable sources, places that have been tested over time to provide reliable information. I've been in the church all my life. I don't know many pastors who get up and want to or church clerks or people who want to get up and just make announcements that are false, that are not tested, that are not proven. And so I just think that we need to rely upon the institutions that have brought us a mighty long way. And the church has been that institution. Particularly African-American doctors have been that institution as well, to begin to share. When we would go to other European doctors, many of them, I remember when my children were born, my father-in-law had mentioned that, he's a physician, and he said, look, you make sure that your children have doctors of color, because if the doctors of color are going to check for sickle cell, the other doctors may never check that. And we need to have these institutions that we trust and the people that we trust. So I challenge all of who are listening and all who are online and who will listen to this in the future, go to reliable information. Go to it. Trust some of that information. There are so many hoax and scams on Facebook, so I can't go on Facebook and determine my health screening off of a Facebook post. Do better research than that. And we know that the CDC is proven. We know that hospitals like the University of Chicago and different academic institutions like Rush, these are academic institutions that have proven themselves over and over and over again to do breakthroughs in treatment for cancer and other things. So let's go to them. Tell me that I don't agree with you, Pastor Griffin, but I did research at the Rush, medical clinic and talk to an array of doctors. Then I'm willing to kind of shake my head and go, okay, you may be right. But if you told me you went to some quack doctor who is on the internet and you don't even know where they went to school or anything, I mean, I just don't understand that.
Well said, Pastor Griffin and Dr. Burnett. I'll share a story. So one of the pastors who's a part of the churches with the United Way Chicago shared a story about a young man who was in his 20s. And they were talking about COVID and they were talking about the vaccines. So he said, "Oh, are you getting your vaccine today?" He said, "No, I did my research and I found this out." He said, "Well, son, can you tell me where you got your research from?" "Social media." He said, "No, just like what you said, Pastor Griffin, you have to go to credible sources, people who have done the research, people who have completed all kinds of trials and it's proven versus something someone is saying." So the young man, it took him about 8 months of him doing different research. The pastor never told him to take the vaccine. He told him to do the research on his own. So 8 months later, his research, he came back and he said, "Okay, I'm ready to take the vaccine." And he took the vaccine. Well, he only took it after he changed his way of researching information from social media to reliable media who've done the research. Anything you would like to say, Diane? Any other questions or final comments?
No, I just wanted to say that that was just an excellent example of not being judgmental to people. You can drive so many people away from the goal. And the goal certainly is being vaccinated, but you have to give people time. You have to give people time to do their research, but you want to steer them in the right way toward reliable sources. So I concur with what you have said.
Well, thank everyone. Thank you, Dr. Burnett, and thank you, Dr. Miller, who probably had internet connections and wasn't able to get back on. Thank you, Pastor Griffin, for allowing us to do the things that we do in order to provide accurate information so that people can make informed decisions in whatever choices that they make. And to this audience, good night. Have a pleasant evening.